Hello, everyone. Thank you for joining us today to discuss a paper that brings together a perennial policy issue, privacy, with an immediately pressing crisis, the COVID pandemic. Professor Chang-Tai Hsieh's paper, which he is presenting here, brilliantly uses data from South Korea to estimate the costs and benefits of trading privacy for an effective way of managing the crisis. He'll present his paper and then take questions. If you have questions, please put them in the Q&A box. One advantage of doing seminars this way is, of course, that you can type your questions anytime, no need to wait. I'll moderate the questions once the presentation is finished, and at which time, of course, you can also raise your hand and continue to ask questions. So let me introduce our speaker and get out of the way. Professor Chang-Tai Hsieh is the Phyllis and Irwin Winkle-Reed Professor of Economics and PCL Faculty Scholar at the University of Chicago Booth School of Business. He conducts research on economic growth and development and publishes in the top economic journals, including the Quarterly Journal of Economics, American Economic Review, and the Journal of Political Economy. Professor Hsieh has also been a visiting scholar at the Federal Reserve Banks of San Francisco, New York, and Minneapolis, as well as the World Bank's Development Economics Group and the Economic Planning Agency in Japan. He is a research associate for the National Bureau of Economic Research, a senior fellow at the Bureau for Research in Economic Analysis of Development, and a member of the steering group of the International Growth Center in London, not to mention the recipient of several prestigious awards. Professor Hsieh, let me just hand it over to you.
Okay, great. Yes, can you hear me well?
Yes.
Okay, great. First of all, I want to thank Scott for the opportunity to come and present this work. So what I want you to do is to think back to the world. It almost seems decades ago, but just think back to the world in late February, and think about what we were thinking about in late February. We were focused on the COVID crisis in China. We were focused on the COVID crisis in Iran. And the other place that it's hard to believe, but if you go back and you read the papers at the time, the other place that we thought was going to be a disaster because there was a big outbreak was in South Korea in late February. So what I want to tell you is just to, first of all, there's been a little bit in the media about what's happened in South Korea since then. Despite the fact that it was one of the early epicenters of the disease, what's happened is that South Korea largely managed to contain the disease. So just some basic facts. The city of Seoul, which is what I'm going to focus on here, has about 10 million people. It's about the size of New York City. In terms of the amount of space, it has about half the amount of space. So it's about twice as densely populated as New York City. If you look at the most recent data, the city of Seoul has had a total of about 700 positive COVID cases, 700 cases in total, in total, with one death. With one death, and I don't need to tell you how that contrasts with, the experience of most American cities. And the other thing about South Korea is that they never shut down. Okay, there never was a lockdown of the economy. So that's not to say that there hasn't been economic losses. So I am going to document I'll show you the magnitude of the economic losses, but the economic losses in South Korea are an order of magnitude smaller than what we've seen in other countries. So the downturn, according to the most recent data, the downturn in GDP is about 1%, which is a serious, which is serious, of course, but it's nowhere like what we've seen, say, sadly enough, in the US and in many other countries in the world. So the question is then naturally, well, what did South Korea do? You may have seen lots of news reports about one part of the South Korean strategy, which is massive testing, which they did. Okay. The other part of what they did, which there's been a little bit of discussion of, is that in addition to massive testing, they also had a robust and a vigorous system of contact tracing, not just through the traditional contact tracing where you have contact tracers question people who tested positive, but there also was a legal framework in place in South Korea where once you tested positive, local governments had the legal authority to access your mobile phone and your credit card records. And that was a critical ingredient that allowed them to do contact tracing effectively. So they could go to your mobile phone records, they could go to your credit card records, and they could put together a picture of where you've been in the last 10, 14 days. And we all understand why that's important. The reason it's important is because contact tracing plus testing is only as good as your ability to catch all the people that are COVID positive. But the problem is that we now have a lot of evidence that even with the massive testing program, you're only going to catch a small fraction of the people that are positive. So the best estimates that we have is that even with a massive testing program, like the ones that we put in place in the South Korean put in place, you only get something like 1 out of every 10 COVID positive person. And I don't need to tell you why that's dangerous, because you catch one person, and you quarantine them, so they no longer infect other people, but you still have 9 other people that you still haven't caught. You may catch them in 2 weeks. They may come in for a test in 2 weeks, but between now and then, they're out there spreading. So. And this gets me to my third point of the other thing that South Korea did, which is the thing that I'm going to focus on here, is that in addition to testing and contact tracing, what was also remarkable is what they did with that information. That once that information was put together, most of that information was publicly disclosed. Okay, and what I want to focus on is what were the consequences of public disclosure of people that tested positive, and importantly, where the COVID positive people were over the last 14 days before they tested positive. And I'll show you, exactly what was the information that was disclosed and how that information was used and what were the consequences of the disclosure of information. So, that it's, I don't need to tell you that, if somebody were to tell you, or if there was public disclosure that yesterday, the Starbucks that you go to every morning, there were 4 people there that tested positive and went there yesterday, most likely I would certainly do so, that I would not go to that Starbucks this morning. I mean, it's like the very sensible thing to do, just because it's likely that there probably are people around in that Starbucks that might be positive, but that still haven't tested positive yet. But this is the key, though, that if I was fairly certain that the data was that information was pretty accurate, I could avoid going to that one particular Starbucks, but I could continue to go to another Starbucks that's just 3 blocks away, that if I was reasonably confident that that information was accurate. So think about then what happens. What I get from doing that is that I avoid going to the places where the cost of where the cost of infection or the probability that I'm going to get infected is high. And I go to somewhere else to where the cost, where the probability of getting infected is low. So by doing that, I help spread, I help stop the spread of the virus. Second is that, yes, the Starbucks that got infected, they get no customers, so they suffer a loss. That we understand well because we've seen it in the US in the last 3 months. But as long as I know that it's only that one place, or it's only a subset of places, I can continue to go to other places. So then the economic losses are going to be lower, just because I can target what is it that I do in terms of social distancing. And I'm going to show you that was the main, that it's a combination of these two things that was a key outcome of what South Korea did. More broadly, I want you to think about the idea of a targeted social distancing, by which I mean the following. So we understand well why social distancing matters, because the virus spreads through personal interaction, right? That we understand well. But the point is that there is a lot of heterogeneity in the benefit that you get from social distancing. And there's also a tremendous amount of heterogeneity in the cost of social distancing. So let me talk about the heterogeneity in the benefit of social distancing. That what we know is that there are places where the probability of infection is high, and there are places where the probability of infection is low. Okay, that's what I mean. And then so if people were to socially distance in places where the risk is high, the benefit of social distancing there is going to be large, whereas the benefit from social distancing in a place where the risk is low is going to be much lower. But the thing is that we got to know that we've got to know which are the places where the benefit is high and which are the places where the risk is low. That idea, I'm going to call that geographical targeting. Okay, that you want to target your social distancing in places where the risk is high, and you don't necessarily want to target places where the risk of getting infected is low. This is one key part of what disclosure, what the collection of robust information and the disclosure of that information allows you to do. It allows you to target geographically a lot more effectively. You can avoid going to one Starbucks, but you can continue to go to another one. Okay. The other, I'm going to say, heterogeneity, the other source of dimension in the heterogeneity is that people can also differ. We now have a lot of evidence that even the cost of getting infected, the health risk, the health cost differs across people. There are people who are healthy versus people who are sick, people with pre-existing conditions with people that don't have pre-existing conditions, people who are old versus people that are young. And the other part, which I'm going to show you, is that what happened in South Korea is that it's not just that there was geographical targeting, that in a sense that people chose places to go to, places chose people not to go to. There are also big differences across different types of people, depending on what they thought their perceived health risk is. Let me talk about the idea of heterogeneity in the cost of social distancing. If you think about what we've done in the US, we basically forced, not completely, but we basically forced in some cities, like, in the city of Chicago until a few weeks ago, we forced everybody to stay at home. And the idea is that, by forcing people to stay at home, then basically you're not out there. The people who are COVID positive are not out there transmitting the disease. And if you're healthy, you are not at risk of getting the disease. But the cost of that, I mean, we understand that it's been a horrific cost, but the cost differs dramatically across people. That is, we know that there are people for which the cost of social distancing is incredibly high. And there are other people, like I'm going to say for me, it doesn't, in terms of what I do, it doesn't really make that much of a difference whether I work from my office at home or whether I work from my office I work at my office at the university. most local governments in the U.S. have made this distinction between essential jobs and non-essential jobs. But whenever you look at that, you understand that that there's a certain degree of arbitrariness in that. What the South Korean strategy allows people to do is that by providing them with information, it's allowing people to make the decision of if it's very costly for somebody to socially distance, they're not going to do it. If it's not that costly for somebody to socially distance, they're going to do it. So it's about essentially letting the market work. That is, we don't force everybody to go to the same coffee shop. We don't force everybody to go to the same store. We don't force everybody to go to the same restaurant, because we understand that people have different preferences and people have different costs and people have different benefits. So in a sense, if there's a tremendous amount of heterogeneity in the cost, we can lower the cost to society as a whole if we take advantage of the fact that there is this difference. So for people for which it's very costly, they don't do it. But for people for which it's less costly, they're the one that socially distance. Let me say one other aspect of heterogeneity, and I'm listing this because these are going to be the elements that I see in the data. Even for a given person, there could be certain activities that you do for which it's very costly, and other activities that you do for which it's not as costly to socially distance yourself. Think about leisure versus work. It might be the case that it's very costly for you to socially distance yourself from work, but going out with your buddies on a Saturday night, that may not be as costly to you. So then you can decide to socially distance yourself in terms of your leisure activities, but not do that in terms of your work activities. And I'll show you that this is what we see in Korea. So if there's one key message I will want to leave with you, it's the idea of targeted social distancing. That the idea that some social distancing brings about large benefits, other social distancing does not, and some social distancing comes with very large costs, and other types of social distancing comes with very little cost. And the optimal thing for a society to do in this COVID world, in the absence of a vaccine, is that you want to maximize the benefit and you want to minimize the cost. And I'll show you that, this is that's a way to think about one of the consequences of what the South Koreans have done. That is, what you need, the critical ingredient. There are two critical ingredients that you need. Is that you need to have robust information for people to make these choices. And the second thing is that you got to give people freedom, because they are the ones that know what the benefits and the costs are, more so than any government in the world. Okay, so with that said, let me get to the details of what happened in happened in Korea. And as Scott said, feel free to jump in at any time with questions. So let me give you an example of the kind of information that was disclosed. Okay, this is the data that was disclosed in COVID patient number 2. So this was the second person that tested positive in South Korea, and this is the information that was disclosed. It says that this person is a male. It gives you his age. It tells you where the person lives, and what people got through their phones. So this information was sent out via text. It tells you what the result of a contact tracing. It says that this person came back from Wuhan on January 24th. Then it tells you that on January 26th, it tells you all the places that this person went to. When the red stars indicate that the text give the exact name and the address of the store. So it tells you the name and the address of the store and the district where the store was located, and it says what time the person was there. Sometimes when they have that information, they also say whether when this person was in the store or when this person was in the spa, whether this person had a mask on or did not have, or they did not have a mask on. This information was sent it was sent via text. It was put up on a public website for 14 days. After 14 days, the information was removed from the website. But what quickly happened is that app developers started to scrape this data, and they developed apps where they stored this data, and that's where our data is going to come from. So what is now widely available are a bunch of different apps that have scraped this data. And what they do is something like this. So here's an example of what you get from an app. So they basically integrate Google Maps along with the data that they have scraped. And the green circles are the places where the COVID patient positives were. If you click on it, it'll give you details on details on the person. So what you see in South Korea is that people use this to plan where they want to go to. So, you're thinking about going to a particular store or to a particular restaurant, you open up this app and you check. You check, whether you are subjecting yourself to some risk. The different colors in this particular app tell you whether the case was recent or whether there was a case a case in the past. Okay, so I'll give you a specific real life case. One of the things on March 28th, there was a person that eventually tested positive, stopped by to get a coffee. This on March 29th or March 30th. This person tested positive. This person, the officials of the local government, they went to fumigate the coffee shop, and they disclosed the fact that this coffee shop was one of the places visited by this person. That day, not a single person showed up, which is, it's terrible for that coffee shop. They were the innocent victim of the disclosure of information, to be sure. Okay, but what is also true is that nobody went to that coffee shop, but more people showed up in that in similar coffee shops just a few blocks away. Okay, so that's the idea. The idea is that that certain people and certain stores and certain businesses suffer because of this. Okay, but it's targeted towards the places where the risk is high, and other places in which the risk is low, they don't. Okay, so let me show you just what you see. So what we have is that we have mobile phone data from this company called SK Telecom, which is South Korea's largest cell phone provider. And what they've given to us is, for the city of Seoul, they've given us data on the movements of people from the beginning of January until the end of May. So we know where you live, and we know where you go to every day. So let me the next figure I'm going to show you summarizes this data. Okay, so just so that you have a sense. So I'm going to summarize this data by showing you what happens to specific neighborhoods in Seoul. So let me just spend a little bit of time describing this figure. Each observation here is a neighborhood in Seoul. So we classify neighborhoods in Seoul into like 35 different neighborhoods. We know who lives in the neighborhood, and we know who is in the neighborhood in that day, but who lived somewhere else. okay? We're gonna focus on the latter, and we're gonna call that an inflow, okay? What we mean by, and just to be clear, an inflow is basically the number of people that live somewhere else that come into your neighborhood during the daytime. So think of it as the number of people that come to DuPont Circle every day to work, okay? We have that data for every day, so we're gonna just separate, because there are differences. We are gonna separate our measure of inflows by the weekdays and by the weekends, okay? So first, let's focus on the data for the weekdays, okay? So what I'm plotting here, the dot is basically the change in the daily inflow, the average, the change in the daily inflow for the average neighborhood in Seoul, okay? Benchmark to late February, before the outbreak of COVID, okay? So what you see is that in the average neighborhood in Seoul, okay, there was about, if you look at where, at the very bottom of the graph, the trough of the graph, in the average neighborhood in Seoul, the inflows of people fell by 20%. Okay, so the number of visitors. So this is during the weekday. So we think that this is mostly work. Okay, that this is mostly. So that's the average. And what the bars are, it's basically the difference between it's basically the 95% confidence interval in that change. So there are some districts for which inflows fell by 25%. That's the very bottom of that bar. There are other districts where inflows fell, even at the trough, fell by only 5%. Okay, so there are two things I want you to take out of this. One is that as COVID got worse at the beginning of March, throughout. So it's really the first 2 or 3 weeks of March where the COVID crisis was at its peak in Korea. People responded to that information. During the weekday, people stopped going to their usual place of work. Okay, how much? The average was about 20% of the people. But what I also want you to see, and this is going to be a very important part, is that there were big differences across districts. There were some districts that suffered a 25% fall in the number of people that were coming to work, and there were other places where the fall the decline was only 5%. Okay. What you also see in this figure is that by the end of March, which is the very end of the figure, the average district, the change in the inflows by the end of March was basically zero. Okay, but what you also see that it's not just a zero. I want you to focus on that there is still a pretty significant bar, like the gap in the bar. So what that tells you is that even if it's a case that the average district has now gone back to normal in terms of people going back to work, that's what it's saying, okay? But what it's also saying is that even there's been a long run consequence of COVID, in the sense that the average is masking the fact that there's been, it looks like a permanent reallocation in terms of where people are choosing to work. That is, there are some places where by the end of March, as the COVID crisis has mostly gone away, that has suffered a 5% fall in terms of the people that are coming to that place. And at the same time, there are places where there are the districts where the number of people coming there has gone up by 5%. So think of this in terms of the discussion that we have in the US about, proving about people moving work out of crowded downtowns into the suburbs. This is essentially what we're seeing. And then, so on average, everybody has gone back to work in Seoul, but where they've gone back to work has changed. Okay. The next thing I want to show you is what's happened in terms of the weekends. So that's the next figure. So the thing that I just want you to see there is that the mean decline in the inflows during the weekend is about the same, but the dispersion is larger. That is, the extent to which people are just choosing not to go in the places where they used to go to a lot during the weekends, that's been huge. And it's much larger than the decline that you see in terms of where people are, in terms of people's behavior during the weekday. Let me just make one last point. If you look at the figure for the weekends and you look at what the data looks like at the very end of May, it's again gone back to normal. That is, people are now going out on average as much as they used to, but there's a significant dispersion. That is, people are going out, but they're not going to the same places that they used to go to. Okay, there are places that suffer that suffer a decline in terms of the number of visitors, and there are places that in which there are now more people. Okay, and what we do is that we basically take this data, right, and then we basically show. For the sake of that, what I show is that bar. Okay, the difference across neighborhoods is remarkably correlated with two things: with the number of people that tested COVID positive in that neighborhood, and the number of COVID positive people that visited that neighborhood over the last 7 days. Okay, so what I'm saying is that these bars, whether a particular neighborhood is in the upper part of the bar or at the lower part of the bar, you can explain almost all of it by the number of cases, by the disclosure. So another way of saying this is that this difference, the underlying heterogeneity in the impact across different neighborhoods in Seoul, it's all coming from the public disclosure of information. So people do respond to this detailed information. Okay, so what do we do with this then? So let me just give you the just how we think about this data conceptually. Okay, so I told Scott that I wouldn't show you math, and I'm going to say that this is not quite math. This is just, but it's something that you should know. Okay, so the basic model that public health people use is called the SIR model. Stands for Susceptible, Infected, and Recovered model. It's a really simple model. It's been around for 100 years, and all these projections that you should have seen, it's all coming from this model. So let me explain just what exactly this model does. Okay, so it's basically the basic model that we use, that public health people use to make projections of how the disease spreads. Okay, so there are two key things or three key things in the model. There are two types of people. There are people that are infected. That's what I'm going to call I. I is going to be the number of infected people in a neighborhood. And then there are people that I'm going to call S, people who are susceptible, people who are not infected, but they could be infected if they come into physical contact with somebody that is infected. So what this model says, so let me just, it's a really simple, it's a really simple concept, but I put down the math because I think it's easier to see it in the math. That is, suppose that you want to know, how does the number of people that are infected that live in a given neighborhood change? Okay, that's the term on the left. The change in the number of infected people that live in neighborhood I. What does that depend on? Okay, it depends on three things. Okay, it depends on, well, the change in the number of infected people, okay, who live in a given neighborhood. It depends on the number of people who live in the neighborhood, who live in the neighborhood that are currently not infected, but that expose themselves over a certain period of time. Okay, that's the term that's on the right. That's a term that I call pi I j SI. Let me explain what that is. SI is basically the number of people who are not infected that live in neighborhood I. Pi ij is the fraction of people that live in I that commute to neighborhood J, okay, over a certain period of time. So the product of these two things is basically the number of people that live in I that are in J during the that are in J during the day. Okay, so think about the number of people that live in Bethesda that go and they work in in the K Street during the day. Okay, and the idea is that once you go, and even if you are not infected when you leave in the morning, by spending the day on K Street, you get exposed to all the other people that are also on K Street that are infected. Okay, that's the term that's on the left. What does that depend on? It depends on, well, it depends on who else is coming to K Street during the daytime. It's people coming from all of the other neighborhoods of Washington, D.C. And so the term that's on the top is a number of infected people that live in the other district that happen to work in the same district. So what is that? It's a number of infected people that are in the same place during the daytime. Okay, and beta, the last term, is basically what is the transmission rate. That is, if you're in physical contact with somebody, what's the probability that you're going to get infected? Okay, it's a really simple model. I mean, and it's really the basic model that public health people have in mind. And this is really the basic logic behind the lockdown, that even if you are not infected, by going out, you are exposing yourself. And how exposed are you? Well, it depends on where you go to, and it depends on how many infected people are there in the place that you choose to go to. Okay, and the way that a lockdown works is that it basically brings pi ij down to 0. You stay at home, then you're never going to get never going to get infected. Okay. So this is the basic idea. And then if you think about this model, this basic equation, in terms of the figures that I showed you, okay, think about that. What that's saying is that pi ij went down in Seoul, but it went down differentially. That is, in some places pi ij went down by a lot, other places pi ij went down by just a little. Okay. And the permanent effect is that in some places, the permanent effect is that pi ij goes up, and the permanent effect for other places, that pi ij goes down. And then what we show is that that's all driven by the disclosure of information. Okay, so this part is about exploiting the heterogeneity in the benefits from social distancing. That is, what social distancing does is that it brings pi ij down, so you basically stop the transmission. Okay, but the other part of it is that we know that there's a reason why you don't stay at home. The reason you go to work is because you are much more, for some of us, for most of us, you're a lot more productive at work than you are if you are to stay at home. So what we then do is that to capture this idea is that we say, well, pi ij, which is the extent to which people are moving, are commuting across the city, that's the outcome of an economic decision. Okay, what is the economic decision? So let me just sketch out just the bare bones of how we think about this. So we're thinking about what makes up a city. There's a bunch of neighborhoods in a city, and neighborhoods differ by the jobs that they have. Think about these as places that you go to during the weekday, okay? And they differ in terms of their amenities, okay? So it doesn't have to be the case that a neighborhood is good both for jobs and for amenities. So think about K Street. It's probably good for jobs, but you're never going to go there during the weekend, is my guess, because there's not a whole lot of amenities there. But there are other places that could be good for that, in which these are places that you want to go to during the weekend, but you are never going to go there during a weekday as long as you're at work. Okay, so that's the first part. That there are a bunch of different neighborhoods in a city that differ. The second thing we want to think about is that people are also very different. Okay? People differ in terms of how productive they are in a given job. Okay, so the way that I want you guys to think about it is that there are a bunch of different jobs that you can have. They're located in different places. You could choose to work for that company out in Tyson's Corner. You could go choose to work in that company in Bethesda. You could choose to work in the company that's located on K Street, etc. Some people are going to be a lot more productive in that job in Bethesda, and somebody else could be a lot more productive in that job on K Street. So then what that does is that as long as people are different, people are going to make different choices. Okay, you are the person that in which the best match for their skills is the job in Bethesda. That's where they're going to go to. They're not going to choose to work on K Street, but somebody else will make the choice of working on K Street and not work in Bethesda because that person is just fundamentally different. And there's the same idea in terms of local amenities. That is, some people could really enjoy the amenities that you get from DuPont Circle. Other people could hate it, and so therefore they don't go there. They go somewhere else. They go to, I don't know Washington, D.C. that well, but they could go to the mall because Bethesda doesn't have a mall, right? They go to the mall in Rockville or somewhere else. That is it's the idea that people are different in terms of their preferences for where they want to enjoy amenities, and they're also different in terms of how productive they are in a bunch of different jobs. The third thing that we're going to put in place is that there's going to be a cost of accessing each place. Okay, think about that as the cost of driving, the cost of taking the metro, and the time that you have to spend. Okay, we're going to assume that that's the same for every person, and then the outcome that you get from this is that people are going to make different choices, and this is going to be key. That people are different, and they're going to make different choices. And every person is going to choose a job and a place to work during the weekday and a place to play during the weekend. There are amenities that maximizes their income and their happiness during the weekend. So this is just basic market economics. Okay, so that's the way that I want you to think about how we are conceptualizing a city. What does COVID do? Well, what COVID does is that it's going to increase the cost of going to a particular place. The cost is that if you go to a particular place, and there are lots of cases there, the chances that you're going to get really sick is going to be high. So what that's going to do is that it's going to get people to re-optimize. It's going to get people to change, some people to change what they do. And then the other thing, because of the facts that I've shown you, is that there's also a very big difference in terms of how people of different age and different health status respond to this information. So what we're also going to allow for is that the cost of going to a particular neighborhood is going to differ depending on whether you're old or whether you're young, and it depends on what it's going to, and also whether you have pre-existing conditions or whether you don't, or whether you don't. Okay, so this is basically what you get from this structure. That is, you get the idea of geographical targeting, that the cost goes up in some neighborhoods and not in other neighborhoods. You get targeting by age and by health. That is, the cost is higher for people that are old. It's high for people that have pre-existing conditions. But, and this is going to be the other part that is key. That is, the response is going to be very different across people. That is, somebody for which that they really their best match is working in downtown DC, and if they were to work somewhere else, their incomes would go way down. They may choose not to switch, despite the fact that K Street is infected with the virus. So they may choose just because it's so incredibly costly for them to make the switch. And there could be other people, there could be another person that also was working on K Street, for which they can easily substitute and go somewhere else. So these people, they choose to, they switch, okay? And even for the same person, even if they choose not to reallocate the place where they work, they could choose to reallocate where they enjoy their leisure. That is because the idea is that if switching their leisure is not as costly, then they're going to do that, even if they choose not to reallocate where they choose to go for work. So that's the basic idea, that you are allowing for selection in terms of who is going to respond to the information, and you're allowing for selection in terms of how they're responding to the information, where they're choosing to go to, and where they're choosing not to go to. Okay, so this is the basic result that you get. Okay, so what I'm showing you here is basically the projection of the model, of basically the combination of these two models. And the first thing I'm going to show you is two scenarios. The black line is basically the fraction of the population in Seoul that gets infected over the next 1,000 days under the full disclosure scenario, which is basically the baseline, which is that, you know, every infected person, the government releases information about where they have been. And basically, our projection of the model is that in the long run, you get about 7% of the population of Seoul that gets infected. This is basically herd, you know, you get to herd immunity in Seoul with about 7% of the population infected. The dashed blue line is what I'm going to call the no disclosure scenario. It's not quite the no disclosure. Think about this as a Swedish scenario, which is that you allow people to do whatever they allow people to do what they want. You disclose the total number of cases, but you don't disclose the individual you don't disclose the individual level of information. So people are responding, but they're not responding in a target, they're not responding in a fully targeted way, and they're responding less. Okay, so what you get in that case is that the number of cases is about 2% higher over the long run relative to the full disclosure case. This difference comes at a cost, of course, because if you don't disclose information, you have lots of people that just don't know. They're going to get infected, but they also work. But you know, they are not going to change their behavior. So the next figure I'm going to show you is what are the economic consequences of these two scenarios. So under the full disclosure scenario, you know, at the worst, you get about a loss of about 1% of GDP. Under the Swedish scenario, you get a loss that's lower. So this, in some sense, is a way to conceptualize the trade-off. You know, the trade-off between economic activity, between income and health or jobs. So again, just to think of this as being, you know, still allowing people to do the free choice in terms of what they want, but giving them information versus not giving them information. That's really about, so the trade-off there is about the trade-off of income and health. Now, the next thing I'm going to show you is to think about how do you want to think about South Korea versus the US or versus China. So now I want you to think about a lockdown, okay? What does a lockdown do, okay? What a lockdown does is that it basically throws away all, it's basically ignoring the fact that people are different.
So Chang-Tai, let me just jump in here for a second.
Yeah.
At some point, we should probably take some questions.
Yeah,
soon.
of course.
So whenever you're whenever you're ready.
I can take questions at any time.
Okay. Well, let me. We have a few here teed up.
Sure.
Let me just. The first two are actually they're asking something very similar. So I'll read them both. And let's see what you have to say. So one says, how do we rapidly inform Americans about the benefits of public disclosure regarding COVID-19 infections to improve our situation as South Korea has? It seems like social perceptions of privacy and personal liberty in the US are major roadblocks to achieving this in a timely manner. And a complementary question by another person is, thinking about the failure of contact tracing in Western countries, despite the legal framework, what was the resistance / acceptance of individuals in disclosing digital and financial history to authorities?
I mean, I don't really have the answer to the two questions. I mean, first of all, I don't think that this. I mean, the one thing that you need for this to work is that you do need to have a robust contact tracing program. And the U.S. is nowhere there in terms of. Yeah, I mean, I can't tell you. I don't know how to you know, that is, I can't tell you what the cost of the loss of privacy is. What I'm telling you here is what are the benefits. I mean, I guess if you were to push me and you were to ask, is privacy really, so suppose that we did have a robust contact tracing program. Suppose that we really do have a legal framework. Right now, we don't. We don't have a legal framework that allows local public health authorities to access phone records and credit card records. Because contact tracing is, you know, if you don't have access to that data, is going to be very, very hard and is likely to be hugely inaccurate. So what you really need, I think, to do this in a cost-effective and an accurate manner is that you do need to access that data. We don't have we don't have the legal framework to do that. South Korea did after, I mean, they put that legal framework in place after their most recent pandemic, which is the Middle Eastern Respiratory Syndrome. They decided that this was something that they need. But suppose that we have that, and if we were to, and then suppose that we were to have that, and I suspect that if we were to go and we were to inform people that if we had this, and if we also did something responsible with this information, and you ask them, well, yeah, there are people that could be hurt. I mean, you think about the case of South Korea, they only disclose the neighborhood where the person lives, they disclose the person's age and sex, but nothing else. Now, it's true that with that level of detail, a close relative or friend of that person could probably figure out who that person was. But you know, if you don't know this person, you couldn't. You couldn't figure out. And then you'd ask, suppose that we were to disclose this information for 10,000 people, is that worth it? Is that a cost worth paying to save 130,000 lives, and you know, whatever the number of cases are that we have in the U.S., 3 billion was the latest number that I saw, and a 15% downturn in our income. I mean, we should have that debate. You know, it's about this trade-off, right? And then I just think that it's a debate that we really. It's that we really haven't had this debate.
So let me ask, I mean, this is of course part of the debate, and I don't know that the information exists even to really answer it, but do you get the sense that that in the US we're making a rational trade-off to not have these apps given our preferences for privacy relative to those in South Korea? Or is it more that we don't here have a sense, people don't understand what the benefits are. I guess, is it possible to have, different answers in different countries based on their preferences, and do those in the US make, are our actions rational based on our preferences?
I don't think it's a rational debate. And here's what I think it is: that it's all dominated by by people who think about privacy, and people and medical and people in the medical profession, and they're thinking about one side of the ledger, which is the cost of the privacy to the patients. But there's nobody on the other side thinking about what the social benefits are for other people, for the disclosure of information. It's going to take somebody. It's going to take some lobbying group or somebody, because right now I think we only had advocates for one side, and we have nobody on the other side that says that, look, nobody wants to invade your privacy. That's not the point. But the point is to save our health and to save our economy, and then we should so I don't think it's a conscious decision. I don't think it's a conscious decision. I think that with almost that's my view. But I'm not in DC. I'm not in DC, so I don't really know what the sides are. But I just, my sense is that we're only hearing from one side, and we're not hearing, or the people from that are on the other side, we haven't really heard. Or I would say two things: is that we haven't thought that clearly about what the potential benefits might be, and we're also not that organized on the other side. The little bit that I have seen on the other side in the city of Chicago is that there has been a push by first responders in the city of Chicago to get the city's public health department to tell them when they're responding to an emergency, whether the person or that place that they're going to has somebody that is COVID positive, because that affects what they do when they show up. But that's the extent of it. So that is still a debate in the city of Chicago that is ongoing. But that's only just a minor part of it, right? Because it's not only the first responders that would benefit from that information, but it's also everybody else that would benefit. So if I would say that I think it's hard to make the argument that it's a conscious outcome of a benefit cost calculation.
So one person notes that there are other apps, like one developed at Carnegie Mellon, and there are others at MIT and others that focus more on preserving privacy. Do you think that, could those work as well as the ones used in Korea that did not preserve that level of privacy?
They could work in terms of contact tracing. So there's one part which is, so when you think about what South Korea did, it's basically two parts of what they did. One is what they did in terms of contact tracing. And you could do the contact tracing, but keep it all a secret. The secret. All you do with contact tracing is that you basically quarantine people that test positive, and you use contact tracing to find other people that could be positive. You encourage them to get tested. If they test positive, then you quarantine them. My sense is that is the way that we are thinking about using contact tracing in the US. So think about that as being the scenario that I call the no disclosure scenario. That is basically, you do massive contact tracing, you find the people that are infected, you take them out of circulation so that they no longer infect other people. But nobody knows about it, okay? and because nobody knows about it, what I'm saying is that given all the information that we have, is that for every person that you get, there are 9 other people that are walking around that you don't get. That's the cost of that strategy. Of that strategy. That's even assuming that you do contact tracing in a robust way, right? And to do what I'm also saying, what I've seen in the South Korean case, is that to do it in a robust way, it's very hard to do it in a robust way if you don't have access to electronic records. Yeah, but that's really the thing in the U.S. Like when I look at what the U.S. done, we've not really thought that. I must say that what I've seen in the U.S. do is that it's that for the most part it's gone about this without thinking in a clear way. That's not to say that every place in the world has gone about it in a clear way, but I think if we want to do better, we should try to learn, from places that we think we can learn from, and try to stop doing things that are disastrous.
Sounds like good advice. Another question that's sort of from a completely different perspective, or a different aspect to it. This person asks whether this was more feasible in South Korea due to a robust and widely available digital and financial footprint. Is there something about the adoption rates of smartphones and broadband, or ways that people use it in South Korea that's different from here that has helped make it easier?
There's no difference in terms of digital pen. There's no difference in terms of digital penetration in Korea versus the U.S. That if there was a legal framework to do it, and if there was a public will to do it, we could do it easily. There is some incredible data out there. I don't know whether you have seen the data that's been put together by this company called SafeGraph. But they do it. That's basically the only data that we have that allows us to measure the extent to which social distancing is happening or not happening in certain places. So the data is there. It's just not being linked, and it's not being linked to the data on cases, and it's not being linked. So it's not really done. It's not. I understand, of course, that the company is getting the data from the cell phone providers, but under certain conditions. So it's not really useful for the purposes of combating COVID.
Another question says, I'm curious about population density and a country's geographic size with regard to COVID-19. So how do those factors affect it? And also continues, is the US naturally disadvantaged by being separated into dozens of population centers with little or no coordination?
That's a very good point. It depends. Let me put it this way. Obviously, at the level of a city, you have to do it at the level you have to do it at the level of a city, because if you only do it in one particular place of the city, given how extensive the links are between people in different neighborhoods, it's useless to do it only in one place. Because the disease is going to leak. So and that I think we understand well. At the level of the country, it depends on the extent to which people are in which different cities are linked. So I can imagine that you need to coordinate between cities that have extensive links. But other cities, I can see how if there are relatively few links, it may not matter that much. So that at the end of the day, it boils down to, and that is, here's another way to say this, that it makes no sense to lock down, say, Washington, D.C., but do nothing about the suburbs of Washington, D.C., just because, you know, it's an integrated community. And the way that the virus spreads is through flows of people. But it may make perfect sense that, you know, you can do something in suburban DC, but you don't have to coordinate with what people in Honolulu do, just because, sadly enough, there are few links between Washington D.C. and so even if the disease is spreading there, it has very little impact on people in Washington D.C. just because you only have a handful of people that come.
Although here's a comment that says something that shows that suggests that somehow the density point can work the other way too. This comment says, my math teacher husband commented that the formula makes him a super spreader because he commutes a distance in a car versus public transport. Fortunately, his campuses are closed, remain online so far. But so does that? I mean, is that a concern that longer commutes? I mean, I guess that's what it implies. Longer commutes make it easier to turn any given person into a super spreader.
It depends on how you do the commute. I mean, it depends on how you do the commute. It depends on whether you do the commute in a car. It depends on whether you do the commute in a public bus. It depends on whether you do it in a crowded subway or whether you do it in a suburban train that is not as crowded. So it all depends on these things. You could model that. I mean, we chose not to do that. We chose not to do that. If you, for those of you who know the field of public health, the basic model that I laid out for you is something that was has been around for 100 years, and a lot of the field of public health has been to basically introduce all these complications. That is, what if some people travel by bus, other people travel by train? What if some people have a lot of social interactions, other people have less social interaction in the same place? And that all complicates the analysis, of course. Mm-hmm. Yeah, we've chosen to go with the model as existed 100 years ago, which is, it's really the bare bones version of the model. But the person who asked the question is absolutely right, that you could make it a lot more complicated. And then the result doesn't really change that much. I mean, it's still the basic idea that when people move across space, they either make themselves vulnerable, or if they are COVID positive, they transmit the disease to other people. That's the basic idea.
Well, I think we should probably wrap up. Although this is a fascinating conversation, we've gone a little bit over time. I really want to thank you for taking your time to join us today. That was a fascinating conversation, and we'll be sure to post the link to your paper for anyone who's interested.
Okay.
All right. Thank you so much, and thank you to everyone who joined us.
Okay. Thank you.